got your clicker, we got a microphone for you. Take it away, Jessica.
Woo! Thank you, Stephen. Thank you, guys.
8 minutes on the clock.
All right. So we're gonna do.
Have fun with it.
Of course, of course. So we're gonna do a health tech summit discussion. Wow, you actually get your voice heard, right? All right. So let's go to slide number 1. So based on observations, interview, and record review, pre the summit and during the summit, here's what the topics are for today, okay? Now, I'm gonna talk, and then we'll let you guys talk too. Cool? Say yeah, yeah. Okay, because when this slide said the author is me, the author is also you, like Soulja Boy says, right? All right, so what are we going to talk about? All right, we're going to talk about reprioritizing AI, or at least the use of AI, right? Because we got to understand the fundamental questions, right? The who, the what, the where, the when, and the why. Right? Here's the thing. Based on everything we talked about today, we're going to focus on the 2 main things, okay? The who, not the band, although they are great, right? And the what, okay? So, based on what everybody was saying today, or at least this is what I heard, and you can correct me if I'm wrong, all right? We, based on what I'm hearing, are speaking mostly to MDs and insurance companies and the AI companies, right? They're all 3 of those people are having, or entities, are having a discussion. Who is left out? Let me ask, who's left out? You can look at the slide. You can pretend like it's English class. Anyone? Nurses, he says. Okay, that's good. Anyone else? Customer, yes. Or, as we call them, patients, residents, depending on what level of care you're in, right? What else? All right. So, you can see right here, the patient's not in here. It should be, and so should their family, or at least their legal representative. That needs to be included in this slide. But why did I emphasize also PT, OT, social work, nurses, and CNAs? Not only because the patients and all these people are included in the care, and they're often missed, but they actually do a lot with billing. Right, PTs, OTs, and STs, they cover a lot of Medicare Part B services. Those are skilled services, right? When you go into a nursing home, when you go into a hospital, that's how it's covered when you're older or when you have a disability, right? And then the CNAs and the nurses are also really important too, right? Not only from a patient care point, right? Because as we know, nurses spend, I think it was at least 30%. I could look this up in the article right here that I saw, okay? Versus doctors who I think are at 16. Well, I'm gonna have to look that up. And if I'm wrong, I'll correct it later in a YouTube comment. Or if I get too lazy, I'm not. But the point is that we really want to talk. Oh, okay. Actually, you can. It's for physicians. This is from the NIH article. 14.73% during the day shift is spent with patients' rooms. Okay. So for nurses, that was 32.97%. Okay. If you want the article, you can hit me up. Now, what do we think about that? What do we think about including 2019. Now, the question is, what should we reprioritize AI about? Okay? Based on what I heard today, a lot of it was on insurance. Okay? Does that seem fair? I don't know. Now, here's what I can tell you. There was a presentation, I'm not going to say names, who talked about, instead of having a team of people decide your care, kind of consolidating it into one person, or at least less people on the team. And they were also talking about getting rid of, they may not have said this, and if they can correct me if I'm wrong, I would be happy to amend this statement, using AI to decide those claims. Here's the thing. You do want a humanistic perspective to supervise, right? Do we agree? Yeah, I see some nods. Yeah, hell yeah, okay. Love it, that's a vibe, that's a vibe. And we want them to be represented, right? Because that's a person. So we want a team of people, because if it's just one person or one machine reviewing our claims, we're probably going to get denied, unfortunately. Now, we talk about what should we use AI for? Not should, but if our goal is to save lives and get money, right? Then, what do we gotta do? Reprioritize. So here's what we're gonna do. Focus AI more on transparency. And I didn't do this slide correctly. You wanna focus more on the cost of care, making it so that people can actually see how much it is to go to the hospital, how much certain procedure codes, right? Because the Trump administration talks about, in 2019, one of the rulings, how there's supposed to be healthcare transparency. I'm not done yet. And they are also...
No time for questions?
No, it's not time yet. It's not 8 minutes. So...
8 minutes, Jess.
Nope, it's not.
Where's your clock?
So it's supposed to be about...
You're in conclusion.
Talk
You're
about-
in the conclusion slide.
Stop.
What happened to that? That's my question. Okay.
We're having a discussion.
Let
You
her
aren't
finish.
even listening.
Let her cook.
You're talking.
Let her cook. Let her cook. She was about to get to it. She was right there. She was right there. Let her finish. Patience over profit. Patience over profit.
We want to talk about patient care and using AI and all this kind of tech stuff for patient care, right?
Music is coming up in 1 minute, just letting you know.
Perfect, that's fine. So we want to use it for patient care. We want to do the tasks that nurses and CNAs and all those people don't want to do, like moving patients, right? Because not only is that a huge burden for us on our backs, but that leads to workers' comp claims. Insurance companies and the hospitals don't want that. Why? Money and less productivity. They have less of a workforce. Who goes and attributes to these workforce? Us, the workers. So, that's why patient care is one of the important parts. Now keep in mind, again, this is out of order, okay? So, what will we do next? Not what I do next, right? Because I'm a part of you guys, right? Woo! What we're gonna do next is focus, reprioritize AI on these things, and that's it. What do you guys think about that?